People in the UK are facing a healthcare crisis today. It's the second day of a strike by 10,000 National Health Service nurses. This is part of a larger wave of job action across the country as the holidays approach. Katie Nicholson is in London, and she's joining us live right in the midst of things. What's going on there where you are, Katie?
Well, we're just outside at Children's Hospital. There's a couple of dozen nurses who've been here since 7 this morning. About a quarter of nursing staff across England are off the job today. All nurses in Northern Ireland, almost all nurses in Wales. This follows strike action on Thursday. It's pretty unprecedented for nurses to go out on strike. Royal College of Nurses in this country actually had a law in its books back in 1995 that prohibited striking. This is, over the last couple of days, really the second time nurses have ever found themselves on a picket line in the UK. At issue is wages. I'm just going to let JF here get a good look here. You'll see from the signs here, there's a lot of frustration and some shock from nurses who 2 years ago were lauded as heroes here for their work during COVID. They are asking for 5% raise above inflation. The inflation rate about 14%, so there'll be a 19% raise. And the government has balked at that so far. That's what's prompted them to be out here. And nurses are saying that raise is justified because right now they are hemorrhaging nurses to other countries. People are leaving for better wages elsewhere. I spoke to one nurse who has been a nurse for 11 years. She's a fourth-generation nurse. She only ever wanted to be a nurse. And for the first time, she's thinking about leaving the profession. Here's Vicky.
Only last week I had another 2 nurses hand in their resignation to me, and one of them is going to another country to do nursing because she's getting better pay, and the other one has left the profession altogether. So this is a real-time problem. This is happening every single day. There are 11,000 vacancies of nursing in London alone.
So with those vacancies, of course, that raises a lot of issues around safety for other nurses. I spoke to Melissa Strickland, a nurse here since 1986, and she talked about how it is starting to feel unsafe, that somehow the NHS is almost being chipped away at. Here's Melissa.
My driver behind here is delivering the best care that we ever can, and the NHS is a fabulous place to work in, but at the moment it feels too challenged. It feels there's a compromise. It feels we're compromising care, and it's with a heavy heart that we're here today. But it's the patient safety that's the driver for me being here.
And interestingly enough, there have been a number of strikes across the country. You would think that people are getting quite exhausted, but the nurses here are enjoying quite a bit of public support as we've been here all morning. Quite a bit of honking, people bringing out food, even patients and their families applauding the nurses as they walk out the entrance here.
Katie, this is incredible to have you right there and to hear those voices, and we'll watch very closely in terms of the impact of this, because the hospitals have warned of a huge risk of harm from this ongoing protest. But this is not the only labor action going on in the country, so who else is hitting picket lines?
Well, railway workers have been on and off strike for months now, stretching back into this summer. People are being warned, don't plan on going anywhere December 24th, December 25th. Royal Post workers, Royal Mail also taking strike action. The ambulance drivers are poised to strike tomorrow. So that is, again, creating more concerns about the healthcare system. What happens if someone is in an emergency situation? We already know that just from the nurses' strikes, thousands of surgeries have had to be scrubbed. So it is putting people seeking healthcare in a precarious position. Baggage handlers at Heathrow are also undergoing quite a bit of labor strife. It's back and forth whether or not they're going to strike through the holiday season or to sort of take action. Firefighters, we're hearing about doctors and teachers possibly taking legal action into the new year. It's a cornucopia of labor action. You have to go back to almost 1978. That was the winter of discontent here in the UK, the last time there was this much labor strife. Back then, the then Prime Minister had to have the heads of the labor unions come and meet him at 10 Downing to sort of open that communication again. And we are hearing from an economist that's what the Prime Minister, the current Prime Minister, has to do right now. Here's that economist.
But I think the Prime Minister perhaps is not stepping in because that might be a signal of weakness. And I think why, as someone I'm speaking as a negotiation expert, that communication is not a sign of weakness. You can stay firm with your position that we can't afford and this and that, but communication needs to be established. I mean, that is what I'm saying. Communication is central to any relationship, and it's relevant here.
Abine Muto there. So essentially, right now, Prime Minister has not blinked. He's holding still. He's sort of standing pat. He is not wiggling. He is not talking. But certainly, this action here designed to try to open the doors to communication and negotiation again.
Katie, thank you for all of that. Live in London, our Katie Nicholson.